Blood culture contamination has been a significant clinical challenge for decades in the United States. In fact, 35 to 50% of all positive blood cultures are actually false positive. On average, 1.2 million Americans annually experience false positive blood culture results and are therefore often misdiagnosed with sepsis. The challenge faced by clinicians is that current phlebotomy best practices can't solve the problem of blood culture contamination. There is a risk of contamination during assembly and preparation of both skin and supplies. You can disinfect but not sterilize skin prior to venipuncture. Even when the skin site is prepared meticulously, up to 20% of skin flora remains viable in the keratin layer of the skin. When venipuncture is performed, skin plugs will always enter the needle lumen and culture specimen bottle and commonly will contain microorganisms known to contaminate blood cultures.